Hi everyone! As you know, Ethicon has an entire portfolio of hemostasis designed to help with bleeding challenges. Today I'm very excited to sit down with Dr. Vander to discuss our most popular hemostat, Spongostan Dental. Dr. Vander splits her time between dentistry on Sherbrooke and Electric City Dental, both located in Peterborough, Ontario. Thank you so much for having us today, Dr. Vander.
Thanks for coming, Caitlin.
So to start, why don't you tell us how you use Spongostan Dental in your practice?
So we use it for any type of extraction, both simple and surgical. It really comes in handy if you have patients who are on anticoagulants or antiplatelets, any type of blood thinner. Also, if even a patient who's not on any of these medications, if clotting is taking longer than normal, it's always great to have these on hand.
What do you like about it?
That it's individually packed, so you can kind of see here how they come individually packed. They're all sterile, and so you don't actually have to cut each individual one. They're all sealed separately, so they stay sterile until the time you have to use it. So that's a really big bonus. Also, the malleability of them. You can easily kind of manipulate them into any shape or size that you want to fit the situation. So those are kind of the main things I like.
Awesome.
Yeah.
Do you want to open one up and show us how simple it is to use?
Yes. So you just peel this, and you can kind of manipulate it into any shape or size that you want. So that's kind of the tubular shape, right? And it's super easy. And you can use multiple if you need to, if you're doing a molar and you need a few of these, and they're all individually packaged, so it's super easy to use.
Awesome. Mm-hmm. Can you touch on the absorbability of the product?
Yeah, so it comes, as you saw, in kind of it acts as a scaffold, right, to start the hemostasis process and help with the clotting process. So you pack it in there, and in a few days it's going to liquefy. You can use it with sutures, without sutures, depending on if you need them or not. And then it's completely absorbed within 4 to 6 weeks. So the patient doesn't have to come back or get anything taken out of the socket. It just completely absorbs. Yeah.
Do you usually use it dry or with a sterile solution?
So you can use it with sterile saline, but I prefer to use it dry. I find that it's easier to manipulate into different shapes when it's in the dry form. I find that if it gets a little too wet right away, it's kind of harder to pack into the socket. Yeah.
Right. To conclude, would you recommend this product to other dentists?
Yes, of course. I was talking to a few other dentist friends when I was preparing to do the video, and I was surprised when basically almost all of them use Spongostan as well. So it's wildly popular on the market, and it's easy to use. We've had no complications to date, and yeah, it helps. It's a good thing to have on hand, right, in case you need help with clotting.
Absolutely. Well, we're so happy that you and others are loving the product.
Yes, I would definitely recommend.
Awesome. Well, thank you so much for having us today. For those of you who do want to place an order, the code is MS0005 and can be ordered through all major dental dealers. If you have any questions, feel free to reach out to me using the email below. Thank you so much again for having us, Dr. Vander. It was great to chat.
Yes, thank you, Caitlin.